Welcome to Evergreen Family Medicine. Today we are with Dr. Patrick Clyde, endocrinologist with Evergreen Family Medicine. Welcome.
Thank you. Thank you for having me.
Thanks for being here. You've been with Evergreen for a little while now, but introduce yourself to people who may be getting to know you for the first time.
So actually, I've been here about 5 years, but prior to that, and I was actually born in Roseburg, but I actually spent most of my life on the East Coast, in the Navy, doing endocrinology. And so I retired from the Navy, and my parents now live in Roseburg, and I knew some old friends from Roseburg, and so I decided to drag my family back from the East back to here, and they did not have an endocrinologist in Roseburg. People had to travel to Eugene, and so it's been nice being here the last 5 years and feeling needed and enjoying doing what I love to do.
Yeah, back home, as it were.
Back home. I was looking forward to coming back to Oregon ever since I joined the Navy, many years ago, and it's great to be back here.
What are some of the diseases or topics or things you deal with as an endocrinologist?
So, the most common disorder that I deal with is diabetes. Most people know what that is. And then there's some other common disorders like thyroid disorders. And most people don't know that endocrinologists are the osteoporosis specialists. So those are some other, and there's many other endocrine disorders. For most people, they probably don't know what endocrinology is. And so maybe I should explain that a little bit.
Sure.
So it's the study of hormones. But most people, when you say hormones, they think about teenagers or women going through menopause. But there's a lot of different hormones that our body makes. And so the endocrine system consists of a series of glands in the body. And these glands make hormones. And these hormones are sent out into the bloodstream. And they go to different tissues in your body. And they kind of control what those tissues do. And if there's a disorder with the hormones of the different tissues, then you get the endocrine disorders like diabetes or hypothyroidism or hyperthyroidism or osteoporosis. So that's what the endocrine system is.
So talk about some of the symptoms that bring people to see you.
So a lot of times the symptoms for endocrine disorders, they can be very non-specific symptoms, like fatigue or weight gain or weight loss. Most people with these problems don't have endocrine disorders, but those are some common symptoms. But for example, someone with newly diagnosed diabetes mellitus might present with losing a lot of weight, urinating frequently, being thirsty all the time. That would be, feeling very fatigued. That would be a common symptoms of presenting with diabetes. Some other ones, interesting symptoms might be someone who's presenting feeling too hot all the time, feeling really hot, losing weight without trying, being shaky, maybe the heart racing and pounding. Those would be some signs of overactive thyroid gland called hyperthyroidism.
Well, it's good because in a lot of these videos, we suggest to people that they pay attention to symptoms like this and just be very clear with their doctor. Be very transparent with the things that you do share, because you might think it's one thing and you might be dealing with something completely different. Do you have advice for people along those same lines?
Yeah, obviously you want to tell your healthcare provider what symptoms you're having, what you're feeling, and the nice thing about endocrinology is that we can look at a patient and have all those symptoms, but then what it comes down to is us measuring hormone levels. So that's how we decide whether these non-specific symptoms are actually an overactive thyroid, overactive or diabetes, or other glands in your body that are overactive. We can order a blood test and go measure the hormone levels, and we can tell you if your symptoms are due to your thyroid or diabetes or some other gland in your body. So we order a lot of blood tests. If you're an endocrinologist, you order a lot of blood tests.
So Dr. Clyde, you deal with glands all through the body. What are some of the other glands that people might not even realize are glands, actually? And is there a particular area of interest for you?
Some of the glands that most people know about are probably the pancreas, because it makes insulin. So that's a common gland, and insulin helps control our glucose in our body. Some other glands would be ovaries for women or testes for men. And then of course there's the master control gland, which is the pituitary gland that sits up behind our eyes, at the bottom of our brain. Then there's the adrenal glands, but probably my favorite gland is the thyroid gland, because I've just over the years, while I was in the Navy and now I used to do a lot of research in that area. And there's really only one type of cancer that I treat on a regular basis, and that would be thyroid cancer. And so I'm interested in thyroid function and thyroid nodules. And so, people have thyroid problems out there in the community, then I feel like I'm, probably the guy you need to see, just because I like the thyroid gland.
And it's unusual, unique, a big benefit for Evergreen to have you here in Roseburg, right? Like you said at the beginning, you don't have to leave town in order to find you.
A lot of patients I see now have been going to Eugene and Medford over the years, and they're just very thankful that they don't have to drive so far. And of course, Evergreen's, they're always so gracious to for whatever I do, and it's great to feel needed.
So Dr. Clyde, tell us what else you would like people to know about endocrinology.
So bone metabolism is an area of specialty for endocrinologists. And the metabolism of bones is controlled by a couple different hormones. One of them being the parathyroid glands, some little glands that sit behind your thyroid gland, and that controls like your body's calcium levels. And then most people don't know that vitamin D is actually a hormone that endocrinologists specialize in. So because of that, those types of hormones, endocrinologists are the experts in osteoporosis, which is a pretty common disorder, but when it gets, there's some more complicated, it's good to come see an endocrinologist for osteoporosis. I think it's important for people to know that.
Terrific. I appreciate all that information, and I think there will be people out there who appreciate it as well. So thank you for your time today.
You're welcome. Appreciate it. Great to be here.
Dr. Patrick Clyde with us here on Evergreen Family Medicine. Of course, you can see more about the providers and their specialties at evergreenfamilymedicine.com, and you can follow Evergreen on Facebook, YouTube, Instagram, and Twitter.